Hey everyone, I'm Dr. Sonia Rapaport, and I'm super excited to be speaking with Dr. Richard Horowitz today. He's a board certified internist who sees patients in Hyde Park, New York at the Hudson Valley Healing Arts Center, where he's medical director. He has treated over 13,000 chronic Lyme patients from all over the US, Canada, and Europe over the past 30 years. And really importantly, he is so very generous with his expertise. He was the founding member and past president of ILADS, the International Lyme and Associated Disease Society, the past president of the International Lyme and Associated Disease Educational Foundation, and was awarded the Humanitarian of the Year award by the Turn the Corner Foundation. He's the author of 2 best-selling books on Lyme disease, Why Can't I Get Better? Solving the Mystery of Lyme and Chronic Disease, which was published in 2013, and How Can I Get Better? An Action Plan for Treating Resistant Lyme and Chronic Disease, published in 2017. He updates his research and is continually coming up with new ideas to help those patients afflicted with these chronic illnesses. And he's developed a step-by-step plan for implementing treatment plans. So we are so very excited to be having Dr. Horowitz join us at the Southeast Regional Integrative Medicine Conference in Asheville this year, where he's going to be talking about his groundbreaking advances in the treatment of tick-borne illnesses with dapsone and his most recent research using high-dose dapsone combination therapy to treat chronic Lyme and associated infections, including Bartonella. Let me ask you, why should practitioners in the Southeast learn about tick-borne illnesses?
Well, mainly because we're in a complete epidemic, and especially in the Southeast. I mean, at this point, Lyme has spread across the world. I used to joke with Pat Smith from the Lyme Disease Association, it's everywhere except Antarctica. And then she sent me a picture of penguins that had ticks on them. So you're not going to be able to avoid this. And we really are in a full epidemic. So the problem now is the ticks are containing so many organisms. You know, the deer ticks, it's Lyme disease at this point, anaplasmosis, babesiosis, the Powassan virus, Borrelia miyamotoi disease. Those are the most common ones in the Ixodes scapularis deer tick and Ixodes pacificus. But you're also dealing with the Lone Star tick, right, which is also in the Southeast. And the mnemonic, I remind people to what's in that tick, I call it TEARS with a V. It stands for tularemia, Ehrlichia, alpha-gal, rickettsia like Rocky Mountain spotted fever, star eye, and viruses like the Heartland and Bourbon virus. So you're dealing with cesspools of these infections that are in ticks. The alpha-gal problem is really spreading throughout the Southeast. It's a big problem now. They just reported it in Virginia, that they're now making it a reportable disease in Maryland and other places. People need to know about these diseases. They need to know about what's in the ticks. How do we treat these different tick-borne diseases? What are the symptoms? What is the differential diagnosis? What's the most cutting-edge treatments, both classical and integrative? So because of the generous amount of time you've given me to share this at the Southeast Regional Conference, I'll be speaking for several days and downloading really some crucial information for any practitioner out there who's dealing with patients who are complaining of a chronic fatiguing musculoskeletal neuropsychiatric illness, which many times is Lyme, but could be long COVID, right? There's a lot of overlaps with chronic fatigue, ME, fibromyalgia. So we'll be discussing a lot of the differential diagnosis, how you establish the diagnosis using a validated symptom questionnaire. And these last articles I've published on dapsone, I have to tell you, they've been literally home runs. I have people now in remission for a year. My wife is in remission for 4 years or longer from these protocols. So it's really exciting. And doctors are a little bit afraid to use this protocol because of the side effects. So I'm going to make sure that everyone who attends this conference, I'm going to be available full-time for you before, during, and after my presentation. So I make sure that when you leave this conference, you are completely confident on how to treat these tick-borne diseases and how to get your patients better.